Hip and knee pain are feelings that many people know all too well. Dr. Rodolfo Gari from Florida Pain Relief Group joins us today to talk about what could be causing this and how you can treat it. Dr. Gari, welcome back to Daytime.
Thank you.
Let's talk about hip pain in women in particular. What are the main causes of that?
Okay. Well, hip pain results from pain in your joints. So our bodies consist of joints everywhere. Now, what's unique about the hip and the knees is they tend to be much larger joints. Mm-hmm. And if you can think about that, your hips is where most of your weight is carried. So in women or men, mm-hmm. What causes that is basically inflammation.
Okay.
So you get inflammation at the joint. Sometimes the inflammation could be caused by injuries, whether it's the tendon or the capsule around there. But basically, it's some sort of inflammatory process that causes that. It could be arthritis. It could be just all kinds of causes.
Okay, so there's a correlation, right, between weight gain and hip pain?
Absolutely. So like we discussed earlier was the fact that the weight is carried there. So the more weight that you have, the more the pain you can have. If you just try to imagine, try to carry a 30-pound dumbbell.
Yeah, no thanks. Can you relieve that pain? How can you do that?
Absolutely.
Without getting a hip replacement?
Sure. So what the way that we relieve a lot of joint pain. So a lot of people have heard of, Motrin, Advil. Mm-hmm. Those are all what's called NSAIDs. They're non-steroid anti-inflammatory drugs. Yeah. So basically, it's to reduce inflammation. So you take a pill for that. The problem with that pill is that it has to go into your stomach, right? Mm-hmm. And then a very small percentage travels into the blood, and then even a small percentage of that goes to the actual joint.
Right. So how do we get to the joint without actually cutting you open and going to the joint?
So what we do at Florida Pain Relief Group is we can actually go ahead and visualize that joint. We give you a sedative, so you don't, in a local anesthetic, mm-hmm. and using image guidance, we can place a needle right into that joint and place the medication there to reduce the inflammation. Mm-hmm. There's also other types of treatments. So, for example, we have these treatments that's kind of like a lubricant mm-hmm. that can last months.
Oh, great.
That can lubricate your joints. We even have regenerative medicine. That's been fantastic. Okay. So what that does is there are these things called allografts, for mm-hmm. example, and the allografts are this material that we use that helps your own body's stem cells concentrate and regenerate your own damage that you have in those joints. So it's your own body healing itself.
Oh, love the sound of that. And so I suppose just like the hip, you can do the same for the knee. I have to ask about shingles, because we're hearing a lot about that lately. A very painful affliction. How can you help people that come in with shingles?
Sure. So shingles is a very common occurrence, especially as we get older. Mm-hmm. And what shingles is, it's actually a recurrence of the chickenpox.
Right.
So the chickenpox virus never goes away. It lives in a dormant state, mm-hmm. and then something happens that triggers that to express itself again. Right. What happens is that the virus, when it expresses, it travels through your nerves, and it travels. That's why you see it in like a certain distribution. Yeah. And as it travels, it just causes major havoc.
Can you do something for that pain really quickly?
Yes, we can.
Thank you. Very good. But get the vaccine, too, if you can.
Yes.
Dr. Gari, appreciate you coming in. If you want relief from any kind of pain, you can make a same-day appointment at Florida Pain Relief Group. Be sure to visit their website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. We'll be right back.